Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Brexpiprazole. Its brand name is Rexulti. Now before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Brexpiprazole works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Brexpiprazole. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. How does Brexpiprazole work? Well, Brexpiprazole is an atypical antipsychotic agent. It is a partial agonist of serotonin 5-HT1A and dopamine D2 receptors. And also, it is an antagonist of serotonin 5-HT2A receptors. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of major depressive disorder, typically paired up with an antidepressant, and we also may see it used in the treatment of schizophrenia. With respect to contraindications or reasons we would not be able to prescribe Brexpiprazole, we wouldn't give it to a patient who had a hypersensitivity to Brexpiprazole or any other component of the formulation. Note about dosing with Brexpiprazole. So in the treatment of major depressive disorder, we would typically see an initial dose of 0.5 to 1 milligrams orally once daily. The patient would have the option to increase the dose in weekly intervals to 1 milligram, then 2 milligrams, and the maximum dose would be 3 milligrams once daily. In the treatment of schizophrenia, the initial dose would be 1 milligram orally once daily on days 1 through 4, and then increase the dose to 2 milligrams orally once daily on days 5 through 7, and then another increase to the target dose of 4 milligrams on day 8. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Brexpiprazole, so we'll go over some of those here now. 10% may experience hyperglycemia, or high blood sugar. 5 to 17% may experience a rise in their serum triglycerides. Weight gain may happen 2 to 30% of the time. 4 to 14% of patients may experience akathisia, and some patients may experience extrapyramidal movements as well. 4 to 9% of patients may experience a headache. Now, some more rare but serious side effects would be a granulocytosis, a seizure, or orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position. That's all we're going to talk about today with Brexpiprazole or Rexulti. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.